Thank you, Mr. Hanson. It's a pleasure once again to serve under your chairmanship. May I begin by paying tribute to my honourable friend for raising the issues in the way that he has. I think he's used Westminster Hall exactly as it should be to bring the concerns of his constituents front and centre before the House. And both to set out the challenges faced, but also the ways forward and a number of solutions in tackling different issues. In short, he raised issues of funding, which relate both to the population but also to the geography, the issue of travel, the potential for further integration, and also a way forward in terms of digital and data. And I will address each of those in turn. It's also, Mr. Hanson, a very timely debate, as the Shadow Minister referred, following the Prime Minister's announcement at the Royal Free Hospital last week of a significant funding boost to the NHS. Alongside that, NHS leaders are drafting a long-term plan, a 10-year plan on services. We'll look at many of the issues he cited in his speech, and therefore bringing the issues of the Isle of Wight front and centre as we start that journey with NHS leaders, I think is very timely and helpful. In terms of the funding formula, I would really segment it in two ways. There's those that are perhaps common with other parts of the country and those that are particularly unique to the Isle of Wight. So the challenges posed by over 80s, the challenge posed by a significant number of constituents with dementia, some of those issues are not of themselves unique to the Isle of Wight. Indeed, I think, Mr. Hanson, you find few members of this House who would not feel that their constituents' particular circumstances merited being higher up the funding formula than they might currently sit. So whilst perfectly valid to raise, and issues which I know NHS England, on the advice of ACRA, who advise on the funding formula, will look at, those are issues common to other areas, but obviously need to be made in respect of the Isle of Wight. And if my honourable friend wishes, I'm very happy to help facilitate a meeting with NHS England in order that those funding pressures pertaining to the demography of the Isle of Wight can be raised with them, because he'll recognise that is an independent process around the setting of the funding formula. In respect of the geography, I do think there are specific issues in terms of the geography, and he made those points very well. Not least, we can all recognise that there are issues around maternity services, paediatrics, certain issues that the island does need to supply, and that will have an impact on its funding. And I'm very happy to look at those issues, but integration is one of the ways that actually headroom will be facilitated in order to meet those challenges. And as he referred to in his remarks, the Isle of Wight was also a vanguard site which received £8.4 million of extra funding since 2015 to facilitate transformation of services. That vanguard again recognised some of the specific challenges linking to the geography that the island has. Whilst that geography could be, and is in certain areas, a disadvantage, a driver of cost, as he set out in his remarks, I think it is also a driver of opportunity, because the island has a strong sense of identity, it has a strong sense of place, it has strong personal links between key decision makers and stakeholders on the island, and I think that is a real opportunity, as the Shadow Minister mentioned, as we move to greater integration between health and social care, reflected in the very name of the department, with the department being the Department of Health and Social Care. I think he's absolutely right that we do need to drive that integration between the council and health services. And he alluded in his remarks to bureaucratic obstacles to that, and I'm very happy to work with my honourable friend to try and facilitate how we overcome any obstacles, because that greater integration is a huge opportunity in terms of looking, as patients present with multiple conditions, as we move away from silos of care into a more holistic approach to patients and their well-being, then the opportunity offered by the island on that. And if I may, I would also link one of his later points around data. I had a very interesting meeting yesterday with the Chief Executive of the Christie in Manchester, one of our outstanding trusts, and I was quite struck by the fact that 19% of patients at the Christie take part in medical research programmes. And he set out how that is hugely beneficial both to the trust but also to the patients. Patients get access to the cutting-edge drugs, the very latest thinking, which brings them benefits, but also for research. Well, I just finished the point, though, but for research, he's been able to attract some of the world-leading figures because he has a population which researchers can then work for, which is very attractive to researchers. So there's a real win-win, and I think the demographic nature of the island offers opportunities in terms of that.
Thank you very much indeed. I think we need to be giving way just on that point. One of the points I didn't make just because of time pressures was that when it comes to looking at, for example, dementia, I think the island would be very open for becoming a national leader or a place where academics and researchers could investigate how we live better in this country with dementia, because we have double the number of national average, so it would be a natural fit for us.
Well, I'm very keen to work with him on that, because I think one of the areas I know from my time in Treasury that the government has prioritised is its research R&D budget. Significant investment has been made in health R&D, and actually one of the opportunities the NHS has is in terms of the patient data and the combination with our world-leading universities and our R&D to actually bring that together, to actually attract researchers, to drive forward the most innovative approach on healthcare, but also then to do what I think is sometimes a frustration of our constituents, is to then translate that cutting-edge research into day-to-day care. Because it's fine to have the research, what we then need to do is roll it out to scale in a way that is meaningful for patients. And I think, therefore, the challenge of the geography of the Isle of Wight is also a huge advantage to it. And I don't know what percentage of patients in the Isle of Wight are currently taking part in research, but that may be an area he wishes to explore, and one which I'm sure the department, again, can work with him on. Likewise, my honourable friend raised the potential in terms of digital. And he will be aware that the Secretary of State has asked Dr. Eric Topple, one of the world leaders on the use of digital in healthcare, to undertake a report for the department. And he's absolutely right. Rather than the need to physically present in all instances in the way that traditionally was the case, there is much more scope using digital to actually go before a consultant online for things to be sent digitally. Now, I recognise that if the CCG is in deficit, then finding the headroom to invest in that technology becomes one of the trade-offs and the challenges. And again, that is one of the opportunities opened up by the Prime Minister's investment in the NHS. It is one of the areas that the 10-year forward view will be examining specifically. And again, I think there's an area, therefore, in timing for the island to look at how it becomes a leader, looking at what has been done with digital enablers within the NHS, the early adopters, and again, which areas the island can lead on technology, because I think, whilst I'll come on to the challenges of travel, actually, if we can reduce the need for journeys, that is obviously a more sustainable solution than seeking to subsidise journeys. So actually, our starting point should be, how do we use technology to reduce the need for as many journeys in the first place, rather than how do we subsidise more journeys. And therefore, that offers, I think, significant scope. On his point, his further point, which was on travel, and I very much heard his remarks in terms of the cost of that, how that has a wider impact on family. It relates to a debate we've had separately around car parking charges, which is a correlation of a similar point. But there are clearly specific challenges relating to travel. But as he also set out in his remarks, there's quite a bit of complexity to it. There are already arrangements in place with the ferry companies. There are already schemes nationally in terms of those who are particularly financially challenged in terms of subsidies and assistance that is given. So there's a question of looking at what existing schemes there are, how we fit with those, what the cost would, what agreements could be reached with the companies concerned. But I'm very happy to meet with my honourable friend to pick up that point specifically, to better understand our current approach and what could be done given the challenges, again, that are not unique to the Isle of Wight in terms of the challenge of distance. But as he mentioned, with the Scilly Islands of the Isle of Wight, there are certain features of the travel that are posing challenges, and I'm very happy to meet with him. But as he will be aware, the NHS Healthcare Travel Cost Scheme provides financial help for travel costs for patients on low income who are referred, and this scheme is part of the NHS low income scheme, under which people are also entitled to free prescriptions and glasses, and under this scheme the full cost of the transport can be reimbursed by the NHS to eligible patients. So there are schemes in place, but I absolutely hear the wider points that he's raised, and I'm very happy to discuss those with him. So in short, Mr Hanson, I think what my Honourable Member has set out is that the Isle of Wight is ideally placed to be at the vanguard of the NHS's approach as we move forward with the 10-year forward view, in embracing digital, in embracing integration, in looking at how we deliver place-based commissioning in the most effective way. There are some specific challenges around its population. There are specific challenges around its geography in terms of travel and in terms of how those interplay, where perhaps the efficiencies of scale, what services are essential on the island, where elsewhere they may be dealt with at a larger population mass. But as we move more widely in the NHS to a hub and spokes model, as we move really to more flexible population sizes, as we look at place-based commissioning, the Isle of Wight, as he sets out, has huge potential to be at the forefront of that. So I'm very happy to follow up this debate with a meeting with my honourable friend to facilitate a discussion for him with NHS England to ensure that we deliver what I know he has campaigned passionately for, which is the best healthcare for the residents of the island, and to ensure that this significant investment set out by the Prime Minister is maximised for his constituents. And in conclusion, Mr Hanson, just to address a final point, the Shadow Minister quite reasonably asked the question on legislation as to whether we were open to change on that. As he will be aware, the Prime Minister, in her remarks at the Royal Free, said to the NHS leadership that we are open to suggestions of that if they feel that is necessary. So as part of the workings of the long-term plan, NHS leaders will need to look at what it is they need, whether under existing legislation, much of the integration, which I know the Mayor of Manchester supports, in terms of the integration that is taking place in Manchester, whether much of this can be done under existing legislation, or whether there does need to be changes, and if so, what that is. And that will be part of the discussions with Simon Stevens and others in the weeks and months ahead.